Hello, and welcome to the Florida Elder Care Training Series. I'm Dr. Evelyn Reed. As a caregiver, you are the most vital component of your loved one's healthcare team. Navigating the healthcare system, with its specialized terminology, brief appointment times, and complex treatments, can be daunting. But how effectively you communicate with providers often directly determines the quality of care your loved one receives. Healthcare providers bring medical expertise, but you bring the expertise on the patient. You see the daily changes, the nuances, and the challenges. Today we will focus on building a productive partnership with your healthcare team. We'll cover how to prepare for appointments, communicate clearly, advocate effectively, and navigate challenges to ensure the best possible outcomes. The first step in fostering a productive relationship is recognizing the distinct roles we play. Doctors, nurses, therapists, and social workers are trained to diagnose and treat conditions. You, the caregiver, provide invaluable observations from your daily interactions. Together, these perspectives create a holistic view. It's not about hierarchy, it's about partnership. We share a common goal, the well-being of the patient. It's crucial to establish your role officially. Due to privacy laws, specifically HIPAA A, providers need permission to share detailed medical information. Ensure that your loved one has signed a HIPAA authorization form allowing providers to speak with you, or that you are designated as the healthcare power of attorney or legal guardian. Make sure every provider has these documents on file. Without them, providers can still listen to your concerns, but their ability to share information back with you may be legally limited. Doctor appointments are often brief. Preparation is critical to ensure discussions are focused and efficient. First, organize your information. We recommend creating a dedicated medical binder. This binder should include contact information for all providers, relevant medical history, recent test results, and referral notes. Next, focus on medication management. Don't just bring a list, bring the medications themselves. We call this a brown bag review. Place every medication, vitamin, supplement, and over-the-counter drug your loved one takes into a bag and bring it to the appointment. This is the gold standard for medication safety. It allows the provider or pharmacist to check for expired medications, dangerous interactions, or duplicate prescriptions from different specialists. Third, track symptoms. Since the last visit, what has changed? Document behavioral patterns, pain levels, sleep quality, or significant events. Be specific. Providers need data. Instead of saying, "He was agitated," say, "He paced the hallway for 2 hours every evening this week and could not be redirected." Finally, plan your questions. Write down your concerns and prioritize the top 3 most important issues you must address during the visit. Don't wait until the end of the appointment to bring up the most critical issues.
Dr. Reed, VO. During the visit, effective communication is key. Present your information factually and clearly. Maria. Dr. Evans, I've noticed that since starting the new medication last Tuesday, my father seems much drowsier during the day and fell twice yesterday. He's never fallen before.
Dr. Reed, VO. That specific detail is much more helpful than a general complaint. Dr. Reed. A specific challenge in dementia care occurs when the patient minimizes their symptoms or provides inaccurate information due to a lack of insight into their condition.
Dr. Evans, how are you feeling, Mr. Jones?
Mr. Jones. Oh, I feel great. Everything is fine.
Maria. Respectfully interjecting. Dad is having a good day today. Doctor. I did want to share some observations from my notes regarding his confusion in the evenings.
Dr. Reed. It's important to respect your loved one's dignity, but you must ensure the facts are presented. Using your documented notes helps shift the focus to objective data. If the topic is sensitive, you can also hand a brief note to the nurse upon check-in or send a message via the patient portal beforehand. Dr. Reed. Now practice active listening and take notes. It is very difficult to remember everything discussed. Consider bringing a second person just to take notes. Dr. Reed, VO. Don't be afraid to ask for clarification. Medical terminology can be confusing.
Mariah. You mentioned his gait is unsteady. Can you explain what that means in plain language and what we should do about it? Dr. Reed, VO. Before you leave, use the teach-back method. Paraphrase the instructions back to the provider. Maria, so just to confirm, we are stopping the blue pill, starting the yellow pill once a day in the morning, and you are sending a referral for physical therapy.
Dr. Reed, this is where your role as an advocate is crucial. Advocacy means ensuring the patient's best interests and preferences remain the priority. Dr. Reed, ask about treatment options, risks, benefits, and alternatives. Also highlight potential challenges with the care plan. For instance, if the doctor suggests a complex regimen, you might say, given his memory issues, taking a medication 4 times a day will be very difficult. Is there a once-a-day alternative? The caregiver-provider relationship is not without its hurdles. We've discussed time constraints. Remember to prioritize your top 3 concerns. If you feel rushed, state it calmly. I understand our time is limited, but I still have critical questions about safety. Can we schedule a brief follow-up call, or can I message you on the portal? Disagreements on care can arise. Approach these respectfully. Focus on the shared goal, the patient. Use I statements such as, I am concerned about these side effects, rather than accusatory language. If concerns remain unresolved, it is acceptable, and often wise, to seek a second opinion. Hospital stays present unique challenges. Communication is often fragmented between different specialists and shifts. Ensure the hospital team knows the patient's cognitive baseline, what they were like before the hospitalization. It's important to know about the CARE Act, Caregiver Advise Record Enable Act, which many states have implemented. This requires hospitals to record the name of a family caregiver, notify them of discharge, and involve them in discharge planning. Before discharge, ensure you understand all medication changes, medication reconciliation, know who to contact with emergencies, and receive training on any new tasks you must perform at home. A collaborative relationship is built on mutual respect and trust. Show appreciation for the provider's expertise, and be honest about any difficulties you face in following treatment plans. We can't help solve problems we don't know exist. Balancing caregiving and advocacy is stressful. Managing your stress and maintaining composure, what we call emotional intelligence, fosters positive interactions. If you are overwhelmed, the quality of your advocacy will suffer. Engage in self-care practices and seek support. You must take care of yourself to effectively navigate the healthcare system for someone else. By focusing on preparation, clear communication, strong advocacy, and trust building, you become an empowered caregiver. You ensure that your loved one receives comprehensive, compassionate, and personalized care, tailored to their unique needs. Remember, you are the expert on your loved one. Your voice matters, and your partnership with the healthcare team is powerful. Thank you for joining us.